Okay, thank you, Dr. Kelly. So it's my great honor to be here to share my group work. So this talk about clinical strategy for treating early traumatic scarring based on the vascular phototherapy. So I come from Shanghai, number 9 hospital. This hospital affiliated to the University of Jiao Tong University School of Medicine. So as a plastic surgeon, we are very care about the scarring. So the scarring is the complication of the wound healing. From this like a wound healing process, we know inflammation, proliferation, and the remodeling involved in the wound healing. And they also cost the results for the scarring. And the one of very important in the early stage of scarring is the angiogenesis. So angiogenesis will cost a lot of redness and a lot of blood vessels, which also give us the targeting for treatment. So this is the feature of the early traumatic scar. There are several things we can see. One is vascular is a very important factor in increase, like cause the immunocell aggregation and the scarring. And also erythema scarring has the thin epilayer and also this blood vessel distribution is different from the like such as pot 1 staining. So from this three-dimensional reconstruction of the vessels in the scar and also in the normal skin by OCT, we can see here, like this is in the scar, they have a much larger of the blood vessel mediators. And also for the density, it's much higher than that in the normal skin. So this tells us maybe we can use the principle of photothermal, like photothermolysis to just target in different layer and the different of the blood vessel. So this is, everyone knows this is what we're going to use laser to reduce the blood supply. For the phototechnology, we use the clinic to treat the scar. We try to reduce the blood vessel, particularly like capillary. And also we try to reduce the recruitment of immunocells and the inflammatory cytokine or inflammatory mediators. This way can inhibit the scar growing. For the laser and the photo device, mostly you can use the IPL or like PDL or like Nd:YAG laser. So the reason for me, the point for me to bring it out in the scarring, we use a lot of IPL to treat the patient in the early stage. Since we saw the picture, the blood vessel, the capillary is more is higher density and much superficial. And meanwhile, the epidermal layer after wound repair is much thinner than the normal skin. So this way, we are not, particularly for the Asian people, so we are not caused the new blood, like a new injury for the scar overgrowth. For the clinical strategy, we try to get the red out. So for the broken vascular in the scarring, we emphasize we started early as possible. This way can reduce blood supply and also reduce the scar growing. And for the device, much better if you are in the early stage, they use IPL. Or if we have very large blood vessel, maybe we can use the PDL or Nd:YAG. And for the endpoint, mostly for IPL treatment, we actually just get a slightly redness and also slightly warm. The purpose we cannot see if you use IPL. But if you use PDL, that we can see the color change. And for the treatment interval, we recommend 1 month normally. And also, we don't want to get a patient like a depigmentation. And another point that we like to see, combination therapy, treatment like get the red oil combined with a fractional laser like CO2, Irving, or even some typical drugs, we can cause the much better results. After treatment, the moisture and the sun protection also we need to do. Here we can see some photos from our group. Like this guy was burned by plastic. So it's a hypertrophic scar, and also the scar is very stiff. After several treatments, his skin actually much less, much softer, and also much less reddening. And this is another patient caused by the traffic. And the car accident, you can see only 2 treatments. After 2 treatments, improved the scar a lot. This girl is also injured by car accident. So after 2 treatments, actually the post 9 months of injury, the results is she feel very happy about this result. And there is this injury, we can see this is 6 treatments. So much better this in the scar improvement. So this is another case. And also we can see some function like improvement after the treatment with DPL, which is IPL, and combined with CO2 fractional laser. So one more and another one. Okay, so thank you very much. So